I wish I could predict that our economy would turn around quickly like it did in 1983 and forward. With the trillions of dollars Congress and the administration have thrown at government and at Wall Street, you'd think we'd already have seen a turnaround. Remember, the current administration told us if Congress would just pass the stimulus bill back in February, unemployment wouldn't go over 8%. Well, it's 9.5% and rising. That's reason for concern in and of itself, and lots of Americans are concerned. In fact, they're scared of all this spending, as they should be. My additional concern, however, is that the two big policy initiatives still being pursued by the administration and the left in Congress are both job killers. They will both hurt the economy and cost our people jobs. The healthcare reform proposals pending in Congress would be catastrophic for small businesses. One would add a new 8% payroll tax on small businesses. Now that's bigger than the payroll tax small businesses pay today for Social Security and Medicaid combined. Another would force some small business to pay penalties of $750 per employee they don't provide health insurance. And all would levy major income tax surcharges on our most successful small businesses. Inevitably, these huge tax increases on small businesses in the hundreds of billions of dollars will require them to reduce their number of employees. When government raises the cost of employing people, employers necessarily employ fewer people. This health care plan also calls for enormous cuts in Medicare spending. One plan cuts Medicare's budget by $489 billion over 10 years. $489 billion. Why? To use the money to create a new health care scheme for people without insurance. Medicare works. Why should we cut the services and choices for people who are on Medicare to create a government-run health care system? Why expand the Medicaid program by half, as Congress proposes, when Mississippi taxpayers already pay nearly $1 billion a year for our share of Medicaid? And as far as the President's daily repeated promise that if you like the health care plan you have today, you can keep it, I suggest you read Section 102B1A of the House Health Care Reform Bill. It says, after 5 years, no health insurance plan can be sold unless it is approved by the federal government's health commissar. Obamacare is a government-run health care system that would result in a federal takeover of 18% of our economy. I'm against it. I hope you'll be against it.